Then the another cardiotoxic plant is the digitalis purpurea, that we started that with the case of the digitalis purpurea. You already learned that in that case the poisoning of the foxglove plant, we need to do the digoxin level, and if it is higher then we have to give the digoxin antibody, that is best cure for the digoxin plant poisoning. So coming to the digitalis purpurea in detail, you can see the picture of the digitalis purpurea plant. The purple color flower with the long stem is the feature of this digitalis purpurea plant. Before coming to the features of this digitalis purpurea, I would like to share the historical background of the development of this plant poison. English physician William Withering first learned of the use of digitalis purpurea in congestive heart failure from an old woman who practiced as a folk herbalist in the one part of the England. He studied it scientifically in the 1775, demonstrating its value in the edema patients. In 1905, James Mackenzie showed its special value was in the heart failure with the atrial fibrillation. Digitalis prepared from it is widely used in cardiology today. In 1930s, Sidney Smith isolated new glycoside, which is called as a digoxin, from the Balkan or the woolly foxglove plant, that is the Digitalis lanata. Digoxin is extracted directly from the plant and is not synthesized. It is thought that the famous Dutch painter Vincent van Gogh may have been poisoned by the digitalis, used at that time as a treatment for epilepsy. His art shows prevalent use of yellow color, which could be because he was suffering from xanthopsia, that is yellow vision, due to the foxglove poisoning. He also painted his physician Dr. Gatchett's picture twice with him holding foxglove plant. So this became an interesting relation with the Vincent van Gogh painter with the foxglove plant. This digitalis word has come from the finger-shaped flowers. So you can see the flowers in the of the digitalis plant are the finger-shaped. So this has been named as digitalis. Then the word foxglove comes from an old tradition according to which the fairies gave the flowers to the foxes to wear on their feet so that they could move in magic silence up to the hands or away from the mans. So this is very interesting that foxglove is the fox gloves that makes them to move silently on the in the jungle. Then the foxglove plant, the entire plant is toxic. Active principle present in the foxglove is the digitoxin, digoxin, digitalin, digitonin, that contains around 30 cardiac and the steroidal glycosides. Fatal dose for digitalin is about 15 to 30 milligram, whereas digoxin it is 4 milligram, and for digoxin it is 10 milligram. One leaf of the foxglove contains the 2 grams of digoxin. So you can assume how much fatal this plant, single leaf of a plant is. Fatal period is about 1 to 24 hours. Then the mechanism of action is the same as we discussed, that is the cardiac glycoside digoxin exert their effect on the myocardial tissues by inhibiting the sodium potassium adenosine triphosphatase, sodium potassium ATPase enzyme, leading to increased intracellular sodium and the calcium concentration. This effect is responsible for both the desired positive inotropic effect and undesirable arrhythmias. Cardiac glycosides are also believed to exert the effect on the autonomic nervous system and causing suppression of sympathetic activation and increased vagal tone. The therapeutic range for digoxin is 0.64 to 1.28 nanomole per liter. Then the treatment for the digoxin shall include, apart from the ABCD, is the stomach wash with the solution of tannic acid, then activated charcoal. The specific management of the digoxin poisoning is the digoxin specific antibody fragment FAB, that is given 1 vial IV in 30 minutes. Each vial of digoxin FAB given intravenously binds with the 0.5 milligram of the digoxin. So according to the concentration of the digoxin in the blood, the amount of the required digoxin specific antibody is calculated, and each vial contains about 38 milligram of the FAB fragments. So if the value is of the digoxin is higher than the 1 milligram, so 2 of the vial will be required. If it is 4, then the 8 vial will be required. In that way, number of vials required for the patient will be calculated depending upon the concentration of the digoxin in the blood. It is assumed that each vial will neutralize the 0.5 milligram of digoxin. So depending upon that, the number of vials will be required for the management of the patient. However, practically this FAB uh, antibody of the digoxin is usually not available in the casualty. In those cases, to manage the arrhythmias, other antiarrhythmic drugs like phenytoin, lignocaine, dilantin and propranolol shall be given. Then the trisodium EDTA shall be given for the calcium excess. Then potassium for the extrasystole and the tachyarrhythmias shall be added because it causes hypokalemia. So extra supplementation of the potassium shall be given. Then bradycardia shall be treated with atropine, and the other symptomatic measures shall be taken as required. Then again here the postmortem findings are not very specific. Only the signs of asphyxia shall be looked upon, and the leaves of the foxglove plant may be noted, and the clinical presentation and clinical scenarios are very helpful in making the diagnosis of the patient. Congestion of the mucosa, hemorrhages in the stomach, the features that we saw in the nicotine poisoning could also be seen in the digitalis purpura poisoning. That is a common type of features that will be seen in the cardiotoxic plants. Then the Nerium odorum. Nerium odorum and the Cerebra thivacea, yellow oleander. You can see this is yellow oleander and this is the white oleander. Both Nerium oleander, that is white oleander or the Canare, and the Thivacea peruviana, that is yellow oleander, belongs to the dogman family. If we go into the history of this plant, even the Bible refers the Nerium oleander as the desert rose, that is used in the Mesopotamia in the 15th century BC as the medicine. Babylonians mixed oleander with licorice to treat the hangovers, and Arab physician used it as a cancer treatment as early as 8th century. It is used in the folk remedy as a cure for the snake bite. Nerium oleander grows wild in India. It is an evergreen shrub that grows to about 6 to 7 meter in height. The flower is usually white in color, that may be pink, dark red or pale yellow in color. It has the 5 petals in a double bloom. That is the characteristic feature of the flowers. The leaves are narrow, lanceolate shape, leathery, dark green on upper surface and the lighter on the lower surface. The same features is seen on the Thivacea, yellow oleander. Only the color of the flower is different. Then all the parts of the plant are poisonous except the root. Active principle of the plant are oleandrine and nerine that resembles digitalis in action. Folinerine, rosazenine is also the active constituent in this plant. The fatal dose of the plant is 5 to 15 leaves and the fatal period is 20 to 36 hours. Treatment is same as that the ABCD care, then the symptomatic care, and even the digitalis management is even seen effective for the treatment of the Nerium odorum, because this DGFB also combined with the oleandrine and the nerine compound. So here DGFB is also seen to be effective for the recovery of the patients. Apart from that, stomach wash and the symptomatic measurements shall be taken. In the postmortem examination, there will be no very specific finding. Signs of suspexia and the presence of the plant in the stomach and the mucosa hemorrhagic and congested may be seen. Pulmonary edema may also be the additional feature. These are all the non-specific features that will be seen at the autopsy. Then for the Nerium odorum, roots, leaves, fruits or seeds are used as a paste or decoction for consuming suicide. In one study in Sri Lanka, Oleander and paraquats were the responsible for 74% of the suicides in the people under the 25 years of age. For the homicidal purpose, it is rarely used due to its bitter taste. Roots are applied locally and ingested can be used or can cause the abortions. Folk treatment in case of swellings, venereal disease, cancers and ulcers are seen. Various parts of the plants are used in treatment of asthma, cancer, cardiac illness, corns, diabetes mellitus, epilepsy and scabies. However, in none of these conditions, it is a good evidence for the genuine cure. So, it shall not be used radically for those cases. It is also used as a cattle poison. Juice of root is applied on a piece of cloth and inserted into the anus of the animal to kill it. Also, the smoke from the burning plant is toxic and can cause death. Hitting the foot directly over the burning twigs can cause death as the poisonous effect is transferred to the foot. Use in the arrow and the dart poisons. It can be detected even long time after the death. It is interesting a story that during the Persian campaigns, Alexander's army lost horses that had fed on the Nerium oleander, and some soldiers also died who had grilled their meat on the skewers made from the wood. Then the yellow oleander, Pila kaneer. All the parts of the Pila kaneer are poisonous, as we saw in the Nerium odorum. Except the roots, all the parts were poisonous. However, in the Cerebra thivacea, all the parts of the plants are poisonous, including the roots. The active principle is the cardiac glycosides, that is thivatine, thivatoxin, nerifoline, perivoside, riboside, cerebrine. And the action of the Cerebra thivacea is similar to the digitalis. Fatal dose is the 8 to 10 seeds, 15 to 20 grams of root and the 5 to 10 leaves. Fatal period is 2 to 3 hours. Cerebra thivacea, similar to the Nerium odorum, can be used for suicidal purposes. Homicide is rare because of its bitter taste. And again, it can be accidentally consumed by the animals as well. You will be seeing this yellow kaneer is being used in the worshipping purpose, and it is seen in all corners of the India. This plant may be consumed by the animals sometimes walking on the streets and can cause the toxic effect on them. Then management is similar to that for the Nerium odolum, and the postmortem changes and the clinical features are quite similar to the digitalis poisoning. Then coming to the Cerebra odolum. Cerebra odolum is also known as Pilikirbir or suicide tree or the orderial tree. The active principle of this plant is cerebrine, cerebroside, odoline, odolotoxin, thivatine and serapine. The fruit of this plant looks like the unripe mango fruit. Fatal dose of this plant is kernel of one fruit and the fatal period is 1 to 2 days. This is a very popular plant for the committing the suicide. That is why it is known as suicide tree. Kernels may be taken as such, and after grinding them with a jaggery or the molasses, sometimes a curry is prepared and taken. Homicide using it is also common. Although the kernels have a bitter taste, this can be disguised if they are crushed and mixed with alcohol or a spicy food. It was used as orderial poison, especially in the Madagascar region of Africa. Orderial poison, already we learned that is the poison that is ordered for the government execution, judicial execution. Also, it is used as a folk medicine. The bark, leaves and the milky juice are used as emetics and purgatives that may cause accidental poisoning as well. The mechanism of action of the cerebrine is that it blocks the calcium channels in the heart, causing disruption in the rhythms. Sign and symptoms appears within 1 hour of intake. Gastrointestinal symptoms appear first. Its taste is bitter, that causes the nausea, severe retching and vomiting, abdominal pain, diarrhea in few cases. Then general weakness, blurring of vision. Cardiac symptoms occur within 3 hours. ECG shows atrial fibrillation and other arrhythmias. SA block, sinus bradycardia and irregular respiration may be present. The management for the poisoning is the ABCD, And then the gastric lavage, then for the symptomatic management, the cardiac features may be countered with atropine given 0.5 milligram IV repeated every 15 to 30 minutes. In the treatment protocol, the aim is to keep the heart rate more than 50 per minute. Then the correction for the hyperkalemia. Death in this case of the cerebral poisoning is usually due to the cardiac failure. On the postmortem, again, it not very specific finding will be seen. Finding of asphyxia will be seen. Eyes will be severely congested, lungs congested, and edematous subpleural hemorrhages may be noted. Then in the heart, subepicardial and the subendocardial hemorrhages. All the internal organs will be congested. The findings suggestive of irritation of the GI tract, like the hemorrhage in the stomach mucosa, congestion, submucosal gastritis may be present. And the best, most important, the clinical notes and the progression of the patient with the proper history will be very suggestive in making the diagnosis of the poisoning with the cerebral. Then the rest of the cardiotoxic poisons we will be talking in the next class. Thank you.